Hello and welcome to Dental Notebook. In today's topic, we're going to read about Pontic. So Pontics is the another component of FPD. Okay. So Pontic is the artificial tooth of the FPD that is going to replace the missing natural teeth. So usually it fills the space which was previously filled by the missing natural teeth, and therefore it restores its functions. Therefore it fills your space and restore its functions. So the name Pontic have been derived from a Latin word pons, which means bridge. So here in this diagram, you can see this is the FPD, alright? And these two structures which are in purple color are retainer as explained previously. And the one which is in the blue color is the Pontic. So here you can see that this Pontic is going to fulfill the missing space over here, the edentulous area over here. And it will make a structure of a bridge. That's why it has been named Pontics. Now let's study the ideal requirements of the Pontics. So the first one is that it should restore the functions of the replaced natural tooth. Alright, so it should restore the function of a replaced natural tooth, such as mastications, then maintaining the spaces. All are the functions of the natural tooth which should be fulfilled by the Pontics. The second criteria which should be provided by the Pontics is the aesthetic and comfort. It means that the Pontics should look good and it should also not irritate the patients. So both aesthetic and comfort are equally important for the Pontics. The third requirement is that it should be biologically acceptable. Biologically acceptable here means that it does not causes any inflammation or allergy to underlying tissue, and it should not impinge the tissue or cause any kind of blanching. So if it doesn't causes any allergy or inflammation, then it is biologically acceptable. So the fourth requirement is the effective oral hygiene. So the Pontic should provide effective oral hygiene by not stucking any kind of food particles in between them, and proper cleaning while brushing should be done. So it should not provide any room for the bacteria to grow. So by this it will maintain a proper oral hygiene. Now next one is to preserve the underlying ridge and mucosa. So what happened due to the heavy occlusion forces, there is a chances of resorption of the ridge and mucosa. So the Pontic should be designed in such a way that the pressure should not go into the ridge or the mucosa, causing it resorption. So preserving the underlying ridge and mucosa is equally important and thus become an ideal requirement for the Pontic. So along with the Pontic should have another requirement is that it should have adequate strength to withstand the occlusal forces. So these are the 6 requirements, the ideal requirements that a Pontic should have. Now coming to the classification. So the classification of the Pontics have been done in 3 ways. The first one is on the basis of mucosal contact, second is on the basis of material used, and third on the basis of method of fabrications. So based on the mucosal contact, it has been again classified into 2 categories. The first is with mucosal contact and the second one is without mucosal contact. Now with mucosal contact here means if the Pontic is in contact with the mucosa, then it is called as with mucosal contact. Without mucosal contact means that the Pontic is not in contact with mucosa, then it is called as without mucosal contact. Now with mucosal contact are further been of 4 types. The first one is your ridge lap Pontics. So ridge lap means that it is going to lap the ridge. So this is called your ridge lap. Okay. The second one is the modified ridge lap. So because there may be some disadvantage present on the ridge lap, therefore some of the modification have been done onto it, and that's why it is called as your modified ridge lap Pontic. The third one is the ovate Pontic. Here it is, the Pontic is in oval shape. The next one is your conical Pontic. It means that the Pontic have a pointed end at the end. So these all are your with mucosal contact Pontic. Now coming next to the without mucosal contact Pontics. So here they have been classified into 2 categories. Without mucosal contact. Why we are giving a without mucosal contact Pontic, though these are aesthetically more good? Because these are very easy to clean. So that's why we have made a without mucosal contact Pontic, and they causes the less irritation. So some of the reason where the aesthetic are not the prime concern, we can give you a without mucosal contact Pontics. All right. So the without mucosal contact Pontics are of two types. The first one is your sanitary Pontic. The sanitary Pontic, you can also call it as a hygiene Pontic. All right. The another one, like there may be some disadvantage like in the ridge lap. So here again it has been categorized into the another category, that is your modified sanitary Pontics. All right. So just like a ridge lap and modified ridge lap, it has been again categorized into the sanitary Pontics and the modified sanitary Pontics. So first we will read about the with mucosal contact Pontics in detail. So the first one, as we have named, the ridge lap Pontics. So the ridge lap Pontics, here I'm going to show you with the diagram here. So you can see this is the proximal view. All right. So this is the proximal view of a teeth, and this is the buccal surface, that is towards the cheek, and this is the lingual surface, that is towards the tongue. So this is the side view of the teeth. You can see this is your ridge here, underlying ridge, and the area which has been colored in blue is the Pontics here. Okay, so the Pontics derived its name from its shape. The shape over here, you can see this is the shape. So it overlaps. It is going to overlap both the buccal as well as lingual surface of the ridge, and that's why it is called as the ridge lap Pontic. Okay, so here you can see that it is overlapping the buccal and the lingual surface, and that's why it is called as a ridge lap Pontic. So it forms a large concave contact with the ridge. So here you can see that it overlaps both the buccal and lingual surface of the teeth, and therefore it's called as the ridge lap Pontic. And because of its overlapping surfaces, it simulates the emergence profile of the missing natural tooth. So it's make a look-alike of the missing natural tooth. Therefore, it becomes aesthetically more superior as compared to the other Pontics. Here coming to the another factor of the ridge lap Pontic, and it's one of the challenging factor of this design, is that it should have a snug fit. It should have a snug fit without displacing the soft tissue or causing any blanching to the underlying tissue or mucosa. So this make it very difficult in designing and therefore limits its use. Now let's study the advantage and disadvantage of this ridge lap Pontic. Though aesthetically it is very superior as it simulates the adjacent natural teeth, okay, but it is rarely used because of few disadvantage. So what are the disadvantage? The first disadvantage is it's difficult to clean. Why? Because the gingival surface below the Pontic is not accessible, and therefore it becomes very difficult for it to get clean, leading to the accumulations of the food and bacteria around it. The second important factor is the tissue inflammation. Though it causes the snug fit, but because of the occlusion and masticatory forces, there may be the chances that they may impinge the tissue, because of which the Pontics get contact with the gingival tissue, leading to the tissue inflammation. And because of these two disadvantages, which hampers the comfort of the patients, leads to its limited use. And because of all this reason, some of the modification have been done in the ridge lap Pontics, and the second Pontics which we are going to study is the modified ridge lap Pontics. Now let's see them in detail. So here is the modified ridge lap Pontic. So I'm showing you the diagram of the modified ridge lap Pontics. So over here, this is the buccal surface and this is the lingual surface of the modified ridge lap Pontics. So here you can see that the overlapping is done only on the buccal surface, whereas the lingual surface, there is no overlapping done on the lingual surface, and the portion of the lingual surface is convex, which is making it very easy to clean. Because the overlapping is done on the buccal region of the ridge, so it also simulates the adjacent natural teeth, and the overlapping is done only onto the buccal region, not onto the lingual region. Therefore it becomes easy to clean also. So it don't contact the lingual region and become easy to clean and maintain the hygiene because of this convex design which runs from mesial to distal region. So, on viewing from the gingival aspect, it should resemble the letter T, whose vertical arm should rest on the crest of the gingiva. So, it is most commonly used in the area with high visibility because it is easier to clean also, and aesthetically it is more acceptable. So, it is generally used in the region with high visibility. Now coming to the advantage and disadvantage. Advantage here is that it have superior aesthetic, and it also maintain the oral hygiene as there is no lingual contact and have a convex design. The disadvantage here only is that hygiene is superior but it is inferior to the sanitary Pontics. Now next coming to the ovate Pontic. So here as the name suggests, ovate means oval. So it is oval in shape and all the surface are convex here. So the convex portion of the ovate Pontics, this reason it is called as your tissue surface. So the tissue convex surface of the ovate Pontics tends to lie within the ridge. So it will give you the appearance as if the teeth is emerging from within the ridge. So aesthetically it is very good. And here in the diagram you can see that this is your ovate Pontic. So you see this is the convex surface of the Pontic which lies within the ridge, and this is your buccal surface, this is your lingual surface, and this one is your convex tissue surface. So this convex tissue surface lies within the ridge, which will give you the profile of the teeth as if it is emerging from within the ridge. So here it's a convex tissue surface of the ovate Pontic lies within the ridge, and it gives the appearance as if the Pontic is emerging from within the ridge. So now let's see the preparation. So the preparation here, how it has been done. So the tissue of the ridge contacting the Pontic is bluntly rounded. So these portion of the ridge is bluntly rounded so that you can make a concavity onto which your Pontic can rest. So the tissue of the ridge contacting the Pontic is bluntly rounded, making the concavity within the ridge, and onto which the Pontic rests. So how it is done? So it is basically prepared by two methods. The first, you can use in a freshly extracted socket also you can use it, or you can surgically also you can prepare it. All right. So by placing the provisional restoration immediately after extraction in a fresh socket, you can also prepare the space for the Pontic, or by the help of the surgery. So if the patient is coming, he is having a ridge, so by the help of the surgery you can remove this portion and make a concavity here onto which your Pontic can rest. Now coming to the indication. So indication, it can be used in a freshly extracted socket by placing a provisional restoration. In anterior missing teeth where aesthetic is of prime concern, you can use it in those reasons. And in the broad flat ridge, what happened in a broad flat ridge, the vertical space is very less for the Pontics. So you can by surgically you can prepare a depression and you can place the Pontic inside so that you can increase the vertical height for the Pontic. So these are the reason where you can use these kind of the Pontics. Now let's see what are its advantage and disadvantage. So advantage is that the Pontic simulate the adjacent natural teeth. So aesthetically it is very superior. It gives you a pleasing appearance, and it is stronger because it has broad convex geometry, and it can be easily flossed again. Why? Because of its convexity. Coming to the disadvantage. Disadvantage is that sometimes it may require a surgical preparation, which is a painful process of course, and proper oral hygiene is required to prevent tissue inflammation because a large area of the Pontic is in contact with the tissue. So proper oral hygiene is required to maintain this kind of Pontics. Next, we are coming to the conical Pontic. So conical Pontic, it means like cone shaped structure. All right. You can also call it as egg shape, bullet shape, or a heart shaped Pontic. So it is generally we have seen that when your ridge is of knife edge shape. All right. Sometimes due to the resorption, the ridge become knife edge shape. So the contact area for the Pontic is very less. So in such condition you have to make the conical Pontic so that only a tip of the convex region is coming in contact with these kind of ridges. All right. So this type of the Pontic is called as your conical Pontic. So here it's a diagram. You can see this is a knife edge ridge. Knife edge is present over here, and only tip of the Pontic is in contact with the ridge. So this kind of the Pontic is known as your conical Pontics. So it's a round Pontic with a small tip in contact with the residual ridge. The second point is that it should be made convex as possible. So all the reason of this Pontic, you can see it is convex. Only one point is in contact with the center of the residual ridge. Next point is the indications. All right. So in the indications, which are the reasons where we can use this kind of the conical Pontic? So we can use in those regions which have knife edge residual ridge. So if a patient mouth is having a knife edge kind of the residual ridge, then you can go for the conical Pontic. Then those molar which does not require aesthetic, you can also use this kind of the conical Pontic in those reason. Now coming to the contraindications. So contraindications, those reason which have a broad residual ridge. So any of those patient who are having a broad residual ridge, we cannot use this conical Pontic in those reason. And in the aesthetic zone, where the aesthetic are the prime concerns, such as in the anterior regions, also you cannot use this kind of Pontics. The advantage of this Pontic is that it can maintain a good oral hygiene. Disadvantage is that it has poor aesthetic. Now coming to the next classification, without mucosal contact. So these kind of the Pontics are not in contact with the mucosa. So first coming to the sanitary Pontic over here, sanitary Pontic, which is also called as hygienic Pontic. This is so because this design allow easy cleaning as the tissue surface of the Pontic remain clear of the residual ridge. So this kind of the Pontic is rarely in contact with the mucosa, so there is no chances of any kind of inflammation here. So this is one of the greatest advantage of this sanitary Pontic, and as the name suggests, sanitary or hygienic Pontic, so cleaning of these kind of the Pontic, maintaining the oral hygiene from this kind of the Pontic is easy. So coming to the sanitary and hygienic Pontic, here you can see in the diagram over here. So this is your sanitary or hygienic Pontic. Here you can see that there is no contact between the ridge and your Pontic. So there you can see this is a kind of a gap which is present over here. Though aesthetically it is not good because you can see there would be a hole in between your teeth and your gums. So you can use in your posterior region of the teeth where aesthetic are of less concern, but maintaining hygiene is superior in these kind of Pontics. So there is no contact with the residual ridge. So you can see this is your occlusal surface of the Pontic, and this is your gingival surface of the Pontic. So the thickness of the occlusal gingival surface of the Pontic should be more than 3 mm because this will provide it an adequate strength to bear the occlusal forces, and in between them there should be a minimum space so that the oral hygiene maintenance can be done easily. So here you can see that the occlusal gingival thickness of the Pontic should be greater than 3 mm with adequate space beneath to facilitate the cleaning. Okay. And it should be made convex, like you can see here it's also convex. So you can see that mesiodistally also it is convex, and buccolingually also it is convex. So it is done for the easy cleaning in this kind of the Pontic. Okay. Now coming to the indications and contraindications, so such kind of the Pontics are generally indicated in non-appearing zone because there is a hole or a gap which is present between your Pontic and your gums, so it will not look good. So generally it is indicated in your non-appearing zone. So next moving to the contraindication. So as you can see, if it indicated in non-appearing zone, then contraindicated in the appearing zone. Coming next to your advantage is like it will provide you good oral hygiene, it will not cause any kind of tissue inflammation. But the disadvantage again here is the poor aesthetic. There is some factor because of this convexity over here, the strength get low. Okay, so it become weak, and the chances of breaking is there is high chances of breaking of such kind of the Pontic because of this convex design over the mesial and distal side. So to overcome such problem, another sanitary Pontic have been designed, which is called as your modified sanitary Pontic. Okay, some of the modification have been done, and what modification? Not much modification. Modification is that done that this region have been made concave in that condition. Here it is convex, but in the modified sanitary Pontic it has been made concave. So here you can see this is an alternative design. Here you can see that facial-lingually there is a convexity, but here the mesiodistally you can see there is a concavity. So this kind of the design will provide you a better strength to the connector in the connector region, and also it will maintain the hygiene of the Pontic. So in the next video we will read the other classification of the Pontic. Thank you for watching the video.